How scary is it to think that every 98 seconds an American is sexually assaulted? Our objectives will be define sexual assault, identify the ways to best help a victim of sexual assault, define SANE, teach about how SANEs help victims, promote therapeutic communication techniques, and discuss myths of rape.
The theoretical frameworks for our project are the prevalence of sexual assault among college students, how SANE nurses have helped in sexual assault cases, rape trauma syndrome in victims, and PTSD effects on sexual assault victims and their recovery.
What is sexual assault? The term sexual assault refers to sexual contact or behavior that occurs without explicit consent of the victim. Some forms of sexual assault include attempted rape, fondling or unwanted sexual touching, forcing a victim to perform sexual acts such as oral sex or penetrating the perpetrator's body. Penetration of the victim's body, also known as rape. Rape is a form of sexual assault, but not all sexual assault is rape. The term rape is often used as a legal definition to specifically include sexual penetration without consent. For its uniform crime reports, the FBI defines rape as penetration, no matter how slight, of the vagina or anus with any body part or object, or oral penetration by a sex organ of another person without the consent of a victim.
The world's most dangerous countries for women. Number 1 is India, Afghanistan, Syria, Somalia, Saudi Arabia, Pakistan, Democratic Republic of Congo, Yemen, Nigeria, and number 10 is United States. The United States is only one Western country on the list. The most countries on the list were from Asia to Middle East Asia and Africa. India has issues of sexual violence, such as sexual assault, rape, and sexual abuse. Approximately 100 sexual assaults are reported to police in the country every day. According to the National Crime Records Bureau, with nearly 39,000 alleged attacks reported in 2016, an increasing of 12% from the previous year. In the United States, since 1993, the rate of sexual assault and rape has fallen 63%. In 1999, the number of sexual assault is almost 600,000 cases in 1 year. From 2006 to 2016, the rate of sexual assault and rape is up and down. The highest number of sexual assault is close to 500,000 cases in 2006. We hope the rate of sexual assault will go down every year. Nearly 1 in 5 Connecticut residents has experienced a sexual assault in their lifetime. 1 in 4 Connecticut women are sexual assault survivors. 1 in 11 women in Connecticut reported being a rape survivor. 60% of victims have told a friend or neighbor about their rape. 32% of victims have never told anyone about being raped.
Anyone can become a victim of sexual assault. 54% of assault victims are between the ages of 18 to 34, and 9 out of 10 victims of rape are female. However, males can also be at risk. Male college students between the ages of 18 to 34 are 5 times more likely than non-students to become a victim. No matter what your age or what your gender, it can happen to anybody. After an assault, victims may deal with many different side effects. They can experience depression, flashbacks, PTSD, substance abuse, sleep disorders, eating disorders, and even contemplate suicide. Because of this, it is important that victims know what steps to take after an assault. Victims can call the National Sexual Assault Hotline at 800-656-HOPE. You'll be connected to a trained staff member from a local sexual assault service provider in your area. They will direct you to the appropriate local health facility that can care for survivors of sexual assault.
In most cases of sexual abuse, the perpetrator is not a stranger to their victim. In fact, 59% of reported cases were known acquaintances and 34% were family members of the victim. Acquaintances of the victim include either a friend or someone who knows of the victim from social interaction. It is not uncommon for the perpetrator to be a current or former spouse, boyfriend, or girlfriend. This chart represents the age percentages of a perpetrator. A common misconception about age is that the assailant is normally a creepy old man luring in children with candy. Perpetrators vary in age, and assigning a specific profile to sex offenders is difficult. Researchers have examined multiple factors, traits, and characteristics of large samples of sex offenders, and have found several issues that seem to be common. These include deviant sexual arousal, cognitive distortions, social, interpersonal, and intimacy deficits, poor coping or self-management skills, a history of maltreatment, and victim empathy deficits. This slide shows examples of common sexual assault myths. The first myth, it is not sexual assault if it happens after drinking or taking drugs. In fact, being under the influence is not an invitation for non-consensual sexual activity. Perpetrators of sexual assault take advantage of the vulnerable person because they are under the influence. Many will use drugs to purposely place a vulnerable person under the influence. Another myth is that rape can be avoided if people avoid dark alleys or other dangerous places where strangers might be hiding or lurking. In fact, sexual assault can occur anywhere at any time to anyone. Since most cases include a known acquaintance to the victim, the assault is likely to occur somewhere where the victim feels safe or wouldn't expect an assault to occur. The final and most controversial myth, that sexual assault is provoked by the victim's actions, behaviors, or by the way that they dress. In fact, sexual assault is never the victim's fault. Sexual assault is not a spontaneous crime of sexual passion, and the victim is not willingly asking to be assaulted.
In a journal article titled The Medical Legal Aspects of Sexual Assault Nurse Examiners Programs, the author Tammy Bimber describes the role of the sexual assault nurse examiner, also known as a SANE, and the benefits of having SANE programs in hospitals. Bimber describes SANEs as having a vital role in the medical and legal outcomes of victims of sexual assault, sexual violence, and rape. SANEs are the professional of choice to conduct sexual assault exams by the American College of Emergency Physicians and the FBI. Here we have some of the key aspects Bimber states a SANE does when presented with a potential sexual assault case. First, they address the immediate and cultural diverse needs of victims of sexual assault in a caring and compassionate manner. They document victims' history of the assault and the forensic exam findings. They properly collect and maintain chain of custody of forensic evidence. They provide fact or expert witness testimonies in court. And most importantly, they refer victims to community agencies to help lessen the immediate and long-term physical and mental suffering and adverse health conditions that many victims experience. Bimber then goes on to explain the benefits of having SANE programs in hospitals. In addition to providing high-quality specialized care and evidence collection, victims that go to a hospital with a SANE program spend significantly less time in emergency departments and receive more community referrals for follow-up care. It assists law enforcement as evidenced by higher rates of victim cooperation with police, and the communities benefit because more perpetrators are incarcerated for longer periods of time, preventing these perpetrators from reoffending in the community due to proper collection of evidence. It should also be noted that since 1992, the Joint Commission established requirements that each emergency and ambulatory care facility develop policies and practices to care for victims of sexual assault, and emergency department staff would be trained according to each institution's policy. Instituting SANE programs in hospitals not only help the victims of sexual assault, but they also help the communities as well.
A 20-year-old woman presents to the emergency department with a report of having been sexually assaulted 24 hours earlier. Upon questioning, you discover she states her perpetrator is one of your nursing colleagues, a nursing grad you have been precepting.
Hey girl! What's wrong? I don't know, I just have a bad feeling something happened at that party I went to. It's fuzzy, but I just feel like I might have been assaulted. No way! So I don't know what to do.
We have to go to the hospital.
Right now?
Yeah. Let's go. Come on, yeah, come on, I'll go with you. Come on.
Hi there. How can I help you today?
Hi, this is Roya. She's my friend. We're coming in because Roya feels that something happened last night at a party. She doesn't know exactly the details, but she really wanted to see someone and get checked out to make sure she's okay.
Okay, it's good that you came here so soon. Could you please fill out some information for us? We will see you soon.
Okay, perfect. Let's go sit down. I'll help you fill it out.
Hi, Lisa. We have a case that requires your attention in the ED. Okay, thank you. See you soon.
Roya? Hi, my name is Lisa. I'm a nurse here at Yale New Haven Hospital. Would you like to go somewhere more we can talk in private?
Can my friend Annie come with me? I think I'm gonna stay here. Just, you can go talk to her alone. Okay. Is that okay with you?
Just follow me. So Roya, I'm a SANE nurse here at the hospital. Do you know what that means?
No, I don't.
Well, it means that I'm specially trained to deal with sexual assault cases.
So how exactly are you going to check me out to make sure I'm okay?
Well, first we're going to talk, I'm going to ask you some questions, and then I'm going to do a physical exam. We're going to draw some blood and some urine, but try not to be anxious. I'm here for you. We'll take our time.
Okay, that sounds fine.
So what can you tell me about last night?
So I went to some party with some friends and I met this guy and we really seemed to hit it off, but it was so loud downstairs we decided to go upstairs so we can talk a little bit more, but that's when things kind of start to get fuzzy. All I really remember is I was trying to push him off me, but he was too heavy, and then from there it's kind of, I can't remember much more.
Okay, it's okay that you don't remember everything. Is there anything you could tell me about the guy in particular?
I remember he said he just got a job as an RN, and that's what really made us connect because I'm in nursing school now too. I think his name was Ben. No, it was Ben. And he had brown hair. That's really all I can remember about him.
So the perpetrator's name is Ben?
It's Ben.
Okay. Can you describe to me what he looked like? Maybe his skin tone, his hair color, any details that you remember?
I'm sorry, I really just don't remember much more other than he had brown hair. It's still pretty fuzzy.
All right. Okay. So no need to apologize. It's as long as you can remember it, any little bit will help. I just want to remind you that here you're safe with me, okay? And I will do everything to get you the help that you need.
Thank you, Lisa. You really make me feel safe. I'm scared no one will find him and that this can happen to somebody else.
Okay, I feel like you're really anxious about this right now. So what I want to do is first I want to take some deep breaths, to bring your anxiety level down. All right, so we're going to have you breathe in through your nose, out through the mouth. So it's like you're inhaling the flowers and blowing out the candles, okay? Let's do it together. One more time. How do you feel?
Yeah, it actually helps.
That's something you can do when you're feeling anxious about the situation. Okay, so I'm done with the questions. So right now we'll just do a quick physical assessment. I'm just going to check you out. Make sure that you don't miss any injuries that you didn't notice. All right, so I'll just need you to sign this consent form, okay? I'll give you a read it over, all right?
Thank you.
All right, so I'm just going to head out. I'm gonna ask you to disrobe and I'm gonna have you put a gown on.
Okay.
All right, and then I'll knock before I come back in, okay?
Sounds good. Thank you.
All right.
Hey Lisa, I've been looking all over for you.
Hey, Ben.
Pantipa told me you were with a new patient. Is there anything I can help you with?
No, I'm all set for the
Are
moment.
you
right?
sure? I really, really want to help out. I want to, know a little bit more about what's going on.
No, well, as you know from your training, you remember HIPAA prohibits me from talking to you about new cases. I'm all good for the moment right now, but thank you for offering.
Of course, I understand. No problem. And if there's anything you need, just let me know, okay?
Sure, I'll let you know.
All right.
Hello? Yes. I need security on the first floor. Yeah, I have this weird suspicion that one of my trainees is involved in something and I'm a sexual assault nurse, and I really think it's him. His name is Ben Slowick. If you could come up as soon as possible, please. Thank you.
Come in.
Hey, Roya, it's just me, Lisa. I have some papers here for you to look over. It's everything that we discussed today.
Okay.
All right, in case you want to, if you have any questions for me, I can answer them for you.
Okay, perfect. No, I think you've covered everything, so I don't really have that many questions.
All right, so I'm going to leave this with you. I'm going to give you a call in about 24 hours just to check on how you're doing. And then if you have any more questions that you think of, don't hesitate to give us a call, okay?
Thank you so much, Lisa. You've been really helpful. I don't know what I would have done without you.
You're welcome. We're going to get through this, all right? Remember, it's not your fault.
So what are you doing for Thanksgiving?
I will go to Florida to see my.
Hello, I'm sorry to interrupt.
No, sorry.
Excuse me, what is your name?
Ben Slowick.
Okay, I'm part of the hospital security. I need to talk to you for a minute. Can you come with me?
Of
Thanks.
course.
What's going on?
I'm sorry, we can't talk about it right now.
What do you think happened to Ben? What are some expected emotional effects that Roya may experience? Why is Lisa's follow-up phone call important in a situation such as this?